Hello and welcome. Let's talk about the skeleton today. Let's talk about the skeleton today. Now, when we go through and we talk about the skeleton, we have gone through and we've seen how the bones that make up the skeleton have been divided up, and they get divided up into a couple of different categories. We divided these bones up into the axial skeleton, you can see here in the light brown, and the appendicular skeleton, which you see here in green. Now, when we go through and we talk about the axial skeleton is going to consist of about 80 bones. It's going to consist of about 80 bones, and these 80 bones, they have been divided into the bones of the skull that we have mentioned, the bones of the vertebral column, and the bones of the thoracic cage. The axial skeleton, it forms the longitudinal axis. It forms the longitudinal axis of the body. The axial skeleton supports the head, it supports the neck and the trunk. It protects the brain, the spine, and also the organs inside the thorax. First here, let's talk about and let's check out another image depicting the same exact thing. Let's go through and let's check out some skull development. Now, when we talk about the neurocranium, it's responsible for enclosing the brain, and it's made up of the base and the calvira, and we'll go through each of those structures there. Now, the visceral cranium is basically your facial bones, and there we'll see they're going to develop from our pharyngeal arches. Very important structures when it comes to embryonic development. And if they don't, if they fail to properly close what's left, and it's some pretty interesting stuff. It's really, really awesome stuff. Embryology is as well. Now, here we'll see both have regions of cartilaginous and membranous origin. Now, we also are going to go through, we're going to check out fontanelles. They're going to be containing fibrous membranes, basically, and it's fibrous membranes that's going to be in gaps between the cranial bones. And we refer to them also as soft spots in layman's terms. And we have 4 different fontanelles that you will be responsible for: the anterior, posterior, sphenoidal fontanelle, and the mastoid fontanelle. 4 fontanelles. All are going to be closed by about 24 months of age. And we'll also check out the mandible. It's 2 bones at birth, and they fuse at the midline. They fuse at the midline to form then 1 bone by 3 years of age. By 3 years of age. And this is just minute, touching on embryonic development and post-embryonic development of bones. A lot of interesting stuff there in relation to bones also. Here then we can appreciate the fontanelles. We'll move over to this image right inside of here. Now, here we can see basically the fetal skull. At birth, then you can see the skull bones are incomplete. The skull bones are incomplete, and they're connected by fontanelles. So what are fontanelles? We said fontanelles are the soft spots. These fontanelles are unossified remnants. They are unossified remnants of fibrous membranes. And what they do is they allow the infant's head to be compressed during childbirth. They allow the infant's head to be compressed during childbirth. And they accommodate brain growth. And they accommodate brain growth. So, like I said, 4 fontanelles. Here we can appreciate the anterior fontanelle. So you can see this is the anterior aspect of the skull. And this is what we're seeing here. Here's the anterior fontanelle. Posterior, you can see right back here. Right back here, we can see it from this lateral view. And then the mastoid fontanelle and the sphenoidal fontanelle are both appreciated from just this view here. You can't appreciate them from the superior view. So the anterior fontanelle you can see is found between the frontal bones and then the parietal bones. That frontal bone, it's two and then it becomes one piece when it fuses. And then the parietal bones, they stay as two separate bones, but then they fuse here and they'll fuse with the frontal bone here also. Posterior fontanelle between the occipital bone and then the two parietal. Sphenoidal, here is the sphenoid bone. So it's in reference to that bone there, but here, I don't know why they chose that bone out of all these other bones. You can see it's at the junction, basically, where all these bones come together. Your temporal, parietal, frontal, and sphenoidal. And then mastoid, here where the parietal, occipital, and you can see temporal bone come together. Mastoid, because this part here is the mastoid process. So I guess this came all in relation to mastoid there. So there's a reference basically to a structure here that's a mastoid, or in reference to that. I'd have to look that up. Next one, let's move to the skull. So let's check out the adult skull then. So here we can see a nice image here. It's 22 bones that are going to be joined by sutures. So the skull is formed by 22 cranial and facial bones. It's formed by 22 cranial and facial bones. So let's talk cranium first. The cranium is going to get divided into the vault and the base. So basically we get this image here, and we make a cut from here down. The vault right up in here, and then the base we've got down here. So all of this is the base, and then this up here would be all the vault. Now when we go through and we talk, the functions of the cranium you'll see is to enclose and protect the brain. And the cranium also furnishes attachment sites for head and neck muscles. So it allows head and neck muscles to come in and attach. Here between these cranial bones, we can appreciate sutures. Sutures are saw-toothed. They're saw-toothed or serrated-looking interlocking joints formed between the bones of the adult skull. Now the cranial vault, also known as the calvira, forms as we can see here, the superior, the lateral, and posterior aspects of the skull, and here we can see the forehead. The base, also known as the floor, it forms the skull's inferior aspect. And the base, we'll see the internal aspect of the base gets divided up into fossae. It gets divided up into fossae. Here we've got the anterior cranial fossae, middle cranial fossae, and posterior cranial fossae. Here you can appreciate them a little bit better. These fossae, as we can see here, as I mentioned to you guys before, contain parts of the brain. So the frontal lobe you can see is found in that anterior cranial fossa, the temporal lobe then here in the middle cranial fossa, and then the cerebellum right back inside of this posterior cranial fossa. So let's go through, nice image there as well. And right here too. Anterior cranial fossa, middle, and posterior. So let's go through and let's talk about then the cranial bones. First bone here we're going to go through, we're going to talk about and we're going to check out is going to be the frontal bone. So here you can see the frontal bone right inside of here. The frontal bone is one bone. It's a shell-shaped bone, and it forms the anterior cranium. It forms the anterior cranium. Now we have a suture. We have a suture we're going to find in relation to this bone and the parietal bones. Here you can appreciate the suture right inside of here, making its way all the way up. And here we can't see it, but then here on the side, you can see coming all the way down right in here. This is going to be known as the coronal suture. The coronal suture. Here you can see it now in its entirety, basically on one side. Now this coronal suture is going to be found where the parietal bones meet the frontal bone. And you can see that there very nicely. Next, then we have the supraorbital margin. The supraorbital margin. The supraorbital margin is going to be the thickened superior margins. It's basically the thickened superior margin of the orbits. You can see on both sides. Thickened superior margin of the orbits. And they're found basically you can see underlying the eyebrows. So the eyebrows will be found overlying these supraorbital margins. So above here we would have eyebrows on both sides. So the supraorbital margin is found lying under the eyebrows. Next, then we have the supraorbital foramen. It's also known as the supraorbital notch. Now, this is an opening above the orbit, so opening above the orbital cavity, and it's going to allow for the supraorbital artery and nerve to pass. It will allow for the supraorbital artery and nerve to pass and make its way up to the forehead. So here we can appreciate the glabella. The glabella is the smooth portion in between the two orbits. Next in here, we're going to be able to appreciate the frontal sinus. The frontal sinus is going to be found in the area just lateral and internal to the glabella. So right here's the glabella. So if we move kind of a little bit lateral, a little off to the side, and you can see here internal. So coming to the inside here, and same thing on this side here. You'll see then this area is going to be riddled inside, and that's where you're going to be able to appreciate the frontal sinus. So here we can see right towards the end, we've got a nice image depicting to us all the different sinuses. So here you can see then the frontal sinuses. And the glabella, we said, is right here at the center. Next then, we've got the zygomatic process. The zygomatic process is going to be found right at the area near the zygomatic bone on the frontal bone, though. Right, the zygomatic process of the frontal bone. So here you can see, we already gave the definition process an idea. We know it's any bony prominence. So the zygomatic process of the frontal bone is what we see here. It's very important you use all of those terms. Next then we have the parietal bones. When we talk about the parietal bones are going to be two large, curved, and rectangular bones. Two large, curved, and rectangular bones. Now, when we talk about the parietal bones, These parietal bones are going to form the superior and the lateral aspects of the skull. They form the superior, we can see here, and the lateral aspects of the skull. Now, we've already talked about the coronal suture. And let's talk about then the sagittal suture. The sagittal suture. The sagittal suture is going to be appreciated, you can see here on the top. So the sagittal suture then is found where the parietal bones meet each other superiorly at the cranial midline. Also, we can appreciate here sutural or wormian bones. Next, then we have the Lambdoid Suture. The Lambdoid Suture. Now, the Lambdoid Suture is going to be found where the parietal bones meet the occipital bone posteriorly. So here you can see where the occipital bone meets the parietal bones posteriorly. Lambdoid Suture. And again, some more sutural or wormian bones. And then last we have our Squamous Suture in relation to the parietal bones. The Squamous Suture. So same thing on the other side as we see here. Now Squamous Suture is found where the parietal bones meet the temporal bones on the lateral side. Then back here we have the occipital bone. And the occipital bone, I want you to know, forms most of the skull's posterior wall and base. And base. You can see that here. It makes its way all the way down. All the way down right inside of there. Right inside of here. Making its way all the way down. Same thing you can see here. Now, when we go through and we talk about this occipital bone, the occipital bone, we've talked about the lambdoid sutures in relation to it. Let's talk about the occipital mastoid suture. Now, the occipital mastoid suture is going to be found where the temporal bones and the occipital bone are going to meet. The temporal bones meet the occipital bones on each side. Occipital mastoid suture. Temporal bones meet the occipital bone on each side. Foramen Magnum we have here in relation to the occipital bone. This Foramen Magnum is going to be a very large hole. It's a very large hole. You can see it here, right inside of here as well. Right inside of there, it's very obvious. Same thing here. Same thing here. Same thing here. And right here. Large hole in the base of the occipital bone. And this is where the inferior brain stem connects with the spinal column. Where the inferior brain stem connects with the spinal column. Now, we flip this around. Okay, we flip the skull around. So basically, you got to make sure you know what you're looking at here. Here, what we've done is we've removed the vault off, and we're looking at the inside. So here, then, we can see, if we flip the skull over, you can see now the inferior aspect of the base. So we're looking at the superior aspect of the base here, but if we flip it around, then we're looking at the inferior aspect of this base. Now, that's what we're seeing right in here. So now here at the inferior aspect of the base, you can appreciate the occipital condyles. Now these occipital condyles are rocker-like, and they're found on the inferior surface, and they articulate with vertebra number 1. They articulate with vertebra number 1, and that will permit us to nod our head in this yes motion. So it's the articulation we have between those occipital condyles and vertebra number 1 that allows us to do this. Move our head in the yes motion. Next then we have our hypoglossal canals. Now the hypoglossal canals are going to be found hidden medially and superiorly. So we're going to move a little medially and then go up. And we move medially and go up, you can see we're going to be basically inside of here. So hidden medially and superiorly to each condyle from the inferior view. When we turn the skull over, you see them here very obviously. Right on the sides of the foramen magnum. The foramen magnum. Now the hypoglossal canal is going to be important as well because the hypoglossal canal is going to contain cranial nerve number 12 on each side. Hypoglossal nerve. Going back to the outside now, we can appreciate the external occipital protuberance and crest. Now let's talk first external occipital protrusion, the protuberance. The external occipital protuberance is a protrusion. It's a protrusion just superior to the foramen magnum. So here we could see the external occipital protuberance. It's a protrusion just superior to the foramen magnum. It's the bulging part of the posterior skull. It's the bulging part of the posterior skull. And it's going to serve, along with the crest, they will both serve as muscle attachment sites. They will serve as muscle attachment sites. And then here we can see flaring laterally from that protuberance is the superior nuchal lines. And then here we can see flaring laterally from the crest, from about midway up the crest, you've got your inferior nuchal lines. Next then is the temporal bones. Now when we talk temporal bones are going to be found inferior to the parietal bones. Nice image here. Inferior to the parietal bones. And they will meet each other at the squamous suture, as we have talked about and we've seen. Now here we're going to be able to appreciate the zygomatic process. The zygomatic process is the bar-like process that meets with the zygomatic bone. So the zygomatic process now of the temporal bone. And that's what you see there. And it'll articulate with the zygomatic bone. Now when the two articulate, then what we form is the zygomatic arch. So the zygomatic arch then is formed by the articulation of the two bones together, as we see here. Next then we have the mandibular fossa. When we talk about the mandibular fossa, the mandibular fossa is a small oval area found on the inferior surface of the zygomatic process. Let's go to the temporal bone itself. So here we'll isolate the temporal bone. So here you can see a lateral view and a medial view. We'll start here. So right down in here, you can see is the mandibular fossa. So this mandibular fossa and the zygomatic process belong to the squamous region of this temporal bone. The squamous region is the area that's adjacent to the squamous suture. And it displays this arm-like process as we've described. And it displays this arm-like process as we've described. Now, jumping back down to this mandibular fossa is going to be important because the mandibular fossa is going to receive the mandible. And when it receives the mandible, they will form the TMJ, your temporal mandibular joint. Your temporal mandibular joint. Next then, let's talk about the tympanic region. Now, the tympanic region is the area that surrounds the external acoustic meatus. It surrounds the external acoustic meatus. The external acoustic meatus is basically the external ear canal. It's the external ear canal through which sound enters to make its way to the tympanic membrane. Also appreciated here is going to be the styloid process. The styloid process. Now, the styloid process is a needle-like structure. It's found below the external acoustic meatus, and it will serve as a muscle attachment site for several tongue muscles and also for neck muscles and for ligaments that are going to secure the hyoid bone of the neck to the skull. So very important structures. Next then we have the Petrous region, or the Mastoid region. Let's go to the Mastoid region. When we talk Mastoid region, the Mastoid region is going to be the area that's found posterior to the squamous. Posterior to the squamous. So here we said was the squamous. Posterior to the squamous. And tympanic region. So posterior to the squamous and tympanic regions. So right back here is the mastoid region. Now the mastoid region exhibits the mastoid process we see right in here that's felt right behind the ear. This mastoid process is going to be an anchoring site for several neck muscles. For several neck muscles. And then last we have the Petrous region. Now the Petrous region displays this miniature ridge on it. This Petrous region is between the occipital bone, which is going to be found located posteriorly, and the sphenoid bones, and the sphenoid bone, which is found anteriorly. Next then here, when we talk about this Petrous region, we're going to be able to appreciate the jugular foramen. When we talk about the jugular foramen is found at the junction of the Petrous region and the occipital bone. Found, you can see, between the occipital bone and the Petrous region of that temporal bone. That's the jugular foramen. The jugular foramen is going to be important because it's going to allow for the passage of the internal jugular vein and also cranial nerves number 9, 10, and 11. Also, if we flip the skull around, we can appreciate now the carotid canals. These carotid canals are going to be found anterior to the jugular foramen, anterior to the jugular foramen on this inferior view. And these carotid canals are going to transmit the internal carotid artery on each side. So they allow for the internal carotid arteries to pass. Next then is the foramen lacerum. The foramen lacerum. The foramen lacerum now is the opening between the petrous region of the temporal bone, the occipital bone, and the sphenoid bones. You can see that from both sides. This inferior view and also this superior view. Foramen Lacerum on both sides. The Foramen Lacerum is going to be important as well. Next then we have the internal acoustic meatus. Internal acoustic meatus. Now the internal acoustic meatus is found anterior to, so a little anterior medial to the jugular foramen on the superior view. Also important. Now, when we talk internal acoustic meatus, it's going to be important because it's going to contain cranial nerves 7 and 8. 7 and 8. Next, then let's move to the sphenoid bone. Let's move to the sphenoid bone. Here we can appreciate the sphenoid bone. The sphenoid bone is described as being a bat-shaped bone. As being a bat-shaped bone. It spans the width of the middle cranial fossa, and it articulates with all bones. It articulates with all bones. We can see that here. Here's a nice view of just this sphenoid bone, superior view. Here we can see a superior and a posterior view. So basically we're looking at it from the top versus we're looking at that bone from the back. So same thing here and same thing here. Now when we go through and we talk about this sphenoid bone, its body, its main thick region, its body will house the sinus. Right? That's the one area, remember again, the sinus is going to be the area that's going to be hollowed out, riddled out. So you really can't do it to these parts right here on the sides. They're all really thin. Nothing here on the sides either. This is going to be done right inside of there. You can see it's a nice thicker part right underneath there. So the body is going to house the sphenoid sinuses. Also, we can appreciate here the Sella Turcica. The Sella Turcica. The Sella Turcica is the saddle-shaped prominence. It's the saddle-shaped prominence on the superior surface of the body. So this whole piece in here is the Sella Turcica. The Sella Turcica. Right inside of there. Same thing you can see here. It's like the saddle. Now, next one we can appreciate the Hypophyseal Fossa. So right inside of here, you can see the indented kind of, this fossa part of that whole Sella Turcica. That fossa part is the Hypophyseal Fossa. And it's important because it's going to contain the pituitary gland. So we talk Hypophyseal Fossa. It's the seat of the Sella Turcica. And it forms an enclosure for the pituitary gland. We can also appreciate here greater and lesser wings. These greater and lesser wings, they're going to help form the anterior and middle cranial fossa. They help form the anterior and the middle cranial fossae. Let's isolate the bones again by themselves, or the bone by itself. Here then we can appreciate the pterygoid processes. The pterygoid processes are going to be found projecting inferiorly, and they project inferiorly from the junction of the greater wing and the body. You can see they project inferiorly. And what they do is they anchor the pterygoid muscles. They anchor the pterygoid muscles. Next in here we can appreciate the optic canal. The optic canal. The optic canal is going to be found anterior to the Sella Turcica. Anterior to the Sella Turcica, and here you can see that very well. You can also see this optic canal from this anterior view. on both sides. The optic canal is going to allow for optic nerve, cranial nerve number 2 to pass. Optic nerve, cranial nerve number 2 to pass. Then here we can appreciate the superior orbital fissure. The superior orbital fissure is going to be found as a long slit between the greater and the lesser wings. Best view to see it was from there. Here you can see it basically right in here. And it's going to be important because it's going to allow cranial nerves number 3, 4, and 6 to pass. Next then we have our foramen rotundum. Now we talk about the foramen rotundum, and you can see the foramen rotundum is going to be found now, you can say posterior lateral to the optic canal. And then moving more posterior lateral, you can see is the foramen ovale. The foramen ovale. And these two structures are going to be important because they're going to allow cranial nerve number 5's fibers to pass. They allow cranial nerve number 5's fibers to pass. Next, then we've got the foramen spinosum. The foramen spinosum. The foramen spinosum is posterior lateral to the foramen ovale, and it transmits the middle meningeal artery. It transmits the middle meningeal artery. So foramen rotundum, ovale, spinosum, and then the sphenoid sinus we talked about within the sphenoid body. So here now we could come up with a little mnemonic to kind of get all these foramina taken care of and a little bit more simplified. Now one way I remember this is Jalota no sorrow. So J for jugular, A for acoustic, L for lacerum. J-A-L, Jalota. And OTA don't have anything that they stand for, so we'll just use the first three, but we'll use the whole term there, Jalota. No sorrow. Sorrow, spinosum, ovale, rotundum, and optic canal. S-O-R-O. So we got foramen ovale, we got foramen rotundum, we said cranial nerve number 5 is going to pass through. We talked foramen spinosum. It transmits the middle meningeal artery. The middle meningeal artery. So the sphenoid sinus then, the sphenoid sinus as we've described before is going to be found located within the body. So right underneath here. And we'll take a look at all the sinuses at the end. Next then we can move on to the ethmoid bone. So here's a nice view of the ethmoid bone. Another view of the ethmoid bone. Another view of the ethmoid bone. Now, when we talk ethmoid bone is found between the sphenoid bone and the nasal bones. So let's move over here. We can appreciate that ethmoid bone here. So it's found between the sphenoid bone, this frontal bone, and the nasal bones. So here we could see, if we look at the nasal bones, it's going to be found located just dorsal to those nasal bones. So right in here, the nasal bones and the frontal bone, and just posterior to that, right behind it, you see it right in here, making its way down into here. Ethmoid bone. When we talk ethmoid bone, the ethmoid bone is one of the most deeply situated bones of the skull. It's one of the most deeply situated bones of the skull. Now, the ethmoid bone forms most of the nasal cavity and also helps to form the orbit. The ethmoid bone has a cribiform plate to it. It has a cribiform plate to it. Here we can appreciate that cribiform plate right inside of here. You can see on both sides this flattened part right down here, and this flattened part right down here on this side. Here, when we isolate the bone, you can see that cribiform plate right inside of here, and here on this side as well. So this whole thing here is the cribiform plate. Now this cribiform plate is found on the superior surface of the ethmoid bone. It forms the roof of the nasal cavity and the floor of the anterior cranial fossa. And the cribiform plate is important because it's going to contain cranial nerve number 1 lying on it. Cranial nerve number 1, the olfactory nerve lying on it. And here you can see you've got all these foramina, these olfactory foramina. These olfactory foramina, or the cribiform foramina, they're also known as, are tiny openings. They're tiny holes on the cribiform plate that are going to allow for the filaments of the olfactory nerve to pass. They allow for the filaments of the olfactory nerve to pass. Here then in the middle of the cribiform plate you can see the crista galli. This picture really doesn't do justice to it, nor does this one. This one here does a little bit more justice to it. Here's the crista galli. The crista galli is a triangular process that's projecting superiorly. Triangular process that's projecting superiorly. See here it's really not doing much justice to it either. But this is that crista galli. It's like the rooster's comb you can think of. It also serves as an anchoring site for the meninges. It serves as an anchoring site for our meninges, which are going to be found inside of here covering the brain. Next then we have the perpendicular plate. The perpendicular plate, you can see right here in the center. The perpendicular plate is going to be found projecting inferiorly into the median plane. It projects inferiorly in the median plane of the nasal cavity, and it forms the superior part of the nasal septum. Which divides the nasal cavity into right and left halves. The nasal septum does. And we'll see the bottom part of that septum as well. And we also have here lateral masses and ethmoid sinuses basically inside. Now the lateral masses and these sinuses are found flanking. They're found flanking the perpendicular plate on each side. And you can see that they're riddled with ethmoidal air, basically cells, and you've got the sinuses in here. Next then we have the superior and middle nasal conchae. Superior and middle nasal conchae. The superior and middle nasal conchae are found extending medially from the lateral masses. They are found extending medially from the lateral masses. And what they are delicately coiled. They are delicately coiled scroll-like structures. They're delicately coiled scroll-like structures. And what they do is they help to create turbulence in the inspired air. And you can see they protrude into the nasal cavity. They protrude into the nasal cavity. Next then here we've got our facial bones. Our facial bones. Now when we talk about our facial bones, the facial skeleton is going to be formed. It's made of 14 bones. The mandible and the vomer bones are the only unpaired bones we're going to see here. The function of these facial bones is to form the framework of the face, also to contain cavities, for our special senses, for our special sense organs, the organs for sight, the organs for taste, the organs for smell. These facial bones also provide openings for air and for the passage of food. They also help to secure our teeth and anchor our facial muscles. Now, when we go through and we talk about the bones, we check out the bones. First bone we'll go through and we'll look at here is the mandible. So here we can see the mandible articulating with the rest of the skull. Here what we could do is we can see a lateral view of that. And here we can appreciate just the mandible on its own. And we talk about the mandible is the lower jawbone. It's the lower jawbone. It's the largest, strongest bone of the face. It has a body to it. The body is going to help form the chin. It's the main thick part of the bone. And the body secures the lower row of teeth. And it secures the lower row of teeth. Here then we can appreciate the ramus, each basically rami there. So here we can see the two upright rami, they meet the body. They meet the body here at the angle, basically, at the mandibular angle. So the mandibular angle is found in between the two. It's found where the body and the rami meet on each side. Next up we have the coronoid process. The coronoid process we can appreciate here. The coronoid process is going to serve as the insertion point. It serves as the insertion point for the temporalis muscle that's going to elevate the lower jaw. Next we have the mandibular condyle. The mandibular condyle articulates with the mandibular fossa, as we can see here. Right, the mandibular fossa of the temporal bone, of the squamous region, and they form the temporal mandibular joint. They form the TMJ, the temporal mandibular joint. Next then, in between these two, you've got the mandibular notch. The mandibular notch. It separates that condyle from the coronoid process. Then here we can appreciate the alveolar margin. The alveolar margin, the alveolar surface, alveolar process. Basically the same thing here. Now, this alveolar margin is going to contain the lower row of teeth. The alveolar margin contains a lower row of teeth, and the alveolar margin is found on the superior aspect of the body. It's found on the superior aspect of the body. Next, then we have the mandibular symphysis. The mandibular symphysis is a slight protrusion found in the midline of the mandibular body. Kind of marking the site of fusion. Then we have the mandibular foramen. The mandibular foramen is found on the medial surface. Found on the medial surface of each rami. And it's going to permit the nerve. It permits the nerve of the lower jaw to pass. So you can see that on both sides. Then is the mental foramen. Next is the mental foramen. The mental foramen is going to be the opening on the anterior aspect. And it's going to allow nerves and vessels of the skin, of the chin and lower lip to pass. It'll allow the vessels and nerves to the skin, or of the skin, of the chin and lower lip to pass. Next in here we can appreciate the maxillae. So here we can appreciate the maxillae. Here's one and here's the other. Now these maxillae are fused medially. They are fused medially, and they form the upper jaw and the central portion of the facial skeleton. Here we can also appreciate the alveolar margin. So here it's found carrying the upper row of teeth. Next, then we have the anterior nasal spine. The anterior nasal spine, we can see, is going to be found now at the junction where the maxillae meet medially. Let's see, we have a picture of the maxillae. So here you could see that spine. So this is one maxilla. Next then we have the palatine process. The palatine process is going to form the anterior 2/3 of the hard palate. So here we can see now we've got that palatine process of the maxilla. It forms the anterior 2/3 of the hard palate. Then the frontal process. When we talk frontal process, the frontal process is going to be found forming the lateral aspects of the bridge of the nose. So the frontal processes of the maxillae on both sides, forming the lateral aspects of the bridge of the nose. And then we have our zygomatic processes of the maxilla. Zygomatic processes where the zygomatic bones articulate with the maxilla. Next then we have the inferior orbital fissure we can appreciate. The inferior orbital fissure. Now when we talk inferior orbital fissure, the inferior orbital fissure is found deep within the orbit at the junction of the maxilla and greater wing of sphenoid bone, where the maxilla and the greater wing of the sphenoid bone come together. Then we have the infraorbital foramen. The infraorbital foramen. The infraorbital foramen is found located inferior to the eye sockets, so below the eye sockets. And it'll contain the infraorbital artery and nerve. It'll allow the infraorbital artery and nerve to pass. Then the maxillary sinuses we'll have here as well in the thicker part of the bones. Next then we have the zygomatic bones. The zygomatic bones are these irregularly shaped cheekbones. They are our irregularly shaped cheekbones. And then our nasal bones are thin, rectangular shaped bones. They're fused medially and they form the bridge of the nose. And then here we can appreciate the lacrimal bones. The lacrimal bones, they're delicate, fingernail-shaped bones. And you can see they also help to form that medial aspect of that orbital socket here. So you can see a lot of bones come together to help form that orbital socket, the orbital cavity, you can say. Same thing with the nasal cavity. Lots of different bones coming together. You got to be able to understand that. Next then is the lacrimal fossa. The lacrimal fossa is basically these deep grooves that are found in relation to the lacrimal bone and the maxilla. They accommodate tears. Next then are the palatine bones. The palatine bones are these L-shaped bones. L-shaped bones, we can see them here. A nice view right inside of here. L-shaped bones. You have first this horizontal plate. It's coming towards us. This horizontal plate, it helps to form the posterior 1/3 of the hard palate. So it completes the hard palate. The perpendicular plate we can see here. The perpendicular plates, they form the lateral walls of the nasal cavity. They form the posterior lateral walls of the nasal cavity. That's why they're L-shaped bones. Next then is the vomer bone. We talk about the vomer. Vomer is a very slender bone. It lies in the it lies in the nasal cavity. Right? Superior to this bone, we saw the perpendicular plate. Now here you can appreciate inferior to the perpendicular plate, that vomer bone, which helps to complete that nasal septum. Next then, let's move down. Let's talk inferior nasal concha. Inferior nasal concha you can appreciate here. The inferior nasal concha are thin, curved bones. They're the largest of the three conchae, and they're doing the same thing, helping to create turbulence in this inspired air. Next then we've got our hyoid bone. Now let's talk hyoid bone. Hyoid bone we can appreciate here very nicely. Now the hyoid bone is not a part of the skull. Okay, it's not a part of the skull. This hyoid bone is going to be found located inferior to the mandible. It'll be found inferior to the mandible in our anterior neck. It serves as a movable base for the tongue, and it's the only bone in the body that does not articulate with other bones. You can see it's found located on top of the larynx. In strangulation deaths, you'll see you can have a fracture in this bone. That you learn more about in forensic medicine. So not a part of the skull. Okay, so here this bone is going to have a few parts to it I'd like you to know about. First is the body. We can appreciate the body here. The body. Next then we have the greater horns. You can see making their way all the way to the back, the greater horns. And then here we can appreciate the lesser horns. The lesser horns. So the hyoid bone. And then here you had your sinuses that we've gone through and we've checked out. There's other bones that are going to be associated with the skull. Besides the hyoid bone, these will be the bones inside the middle ear. Here you can identify them, and then we'll learn more about them when we move to the ear. So next then we can move over to the second part. And here then we can see we'll move down to the vertebral column. Now we talk vertebral column. Vertebral column is a chain of 33 vertebrae, and a few of those vertebrae have been fused together, so you'll have 26 irregular bones that are going to be connected in a flexible way. They'll extend from the skull down to the pelvis. Here you can see them. So the divisions will include first your cervical vertebrae. You have 7 cervical vertebrae. They're also known as the vertebrae of the neck. And these vertebrae take on a concave curvature. They take on a concave curvature. Next we have our thoracic vertebra. We have 12 thoracic vertebra. They're known as the vertebra of the thoracic cage. They take on a convex curvature. They take on a convex curvature. Then we have lumbar vertebra. Lumbar vertebra, 5 vertebra of the lower back. And they take on a concave curvature. They take on a concave curvature. And then down here we can appreciate the sacrum. The sacrum is 5 vertebrae that have been fused together. And they take on this convex curvature. This convex curvature. And then last we have the coccyx, which is 4 vertebrae that have been fused together. These curvatures we've gone through and we've mentioned, what they do is they increase resilience and flexibility. We also have some abnormal curvatures we're going to be able to go through and we're going to be able to check out. Now, here we can see us being compared to a chimpanzee. And you can see it's about the same structure. Okay? But then again, how these parts are kind of found is the difference there, you see. We're upright compared to them. Now, these abnormal curvatures, we can see down here. These abnormal curvatures we can actually see here. They're going to be scoliosis, kyphosis, and lordosis. Scoliosis, as we can see here in the image, is an abnormal lateral curve to this vertebral column. It can cause problems inside the thoracic cavity. Next we have kyphosis. Kyphosis is hunchback. It's hunchback. Next then we have lordosis. Lordosis you can see as a sway back. It's a sway back. So here you could see scoliosis, abnormal lateral curvature. It affects, you can see all the various parts. Kyphosis, the thoracic region. Hunchback creates. And then lordosis, this accentuated curvature in that lumbar region, causing the sway back. Next then we have the intervertebral discs. Now when we talk about these intervertebral discs are cushion-like pads. They are cushion-like pads that are going to be composed of 2 major parts. These 2 major parts will include first the nucleus pulposus, and second, the annulus fibrosus. This nucleus pulposus is the inner gelatinous nucleus that gives the disc its elasticity. And then here, the annulus fibrosus is the outer collar that's composed of collagen and fibrocartilage, as we have mentioned. And here you can appreciate a herniation, a slight hernia, pushing up against that nerve and then transmitting a lot of pain in these patients. Transmitting a lot of pain. So next then let's move to the general structure of a vertebra. When we talk about the general structure of a vertebra, I want you to be able to go through and understand all these different parts that I've mentioned for you on the note taker. And here you can identify them all. And here you can use this picture here to go through them all. What we'll do is we'll go through the specific structures. Okay, so you have to know these general structures as well. Okay, all of them very thoroughly. Know what the lamina are, know what the pedicles are. I'll ask questions in regards to that as well. So here then let's go through, okay, use this picture here as well. And it goes through basically all those parts. Let's go through specific structures. When we talk and we go through specific structures, first what we'll do is we'll check out our cervical vertebrae. When we talk about our cervical vertebrae, our cervical vertebrae will see C1 through C7. They're the smallest and the lightest vertebra. C1 and 2 look different from the others. So we'll look at C3 through C7 first, and we'll see C6 is more C3 to C6 are the ones that look completely alike, but then C7 looks similar to that. It just has a more prominent spinous process to it. So here when we go through and we talk about these vertebrae, I want you to know these vertebrae have an oval body to them. An oval body. The body is small, it's light. Their spinous processes are bifid, except for C7s. The vertebral foramina are going to be large, triangular shaped, as we can see here. The transverse processes exhibit these transverse foramina, these openings. So here you can see the bifid spinous process there as well. So here's vertebra number 7. And you can see vertebra number 7 is vertebra prominens. And you can feel that right at the back of the neck. Next then we have C1, atlas. And then we'll check out C2, the axis. So C1 we can see here. We've got a superior view and an inferior view. It's got lateral masses to it. And these masses we can see have these articular facets on both sides. And here we also have a facet for the dens. The dens is going to be a structure from the second vertebra that articulates, that hits up against this bone here. And here it is right in here, if you can see that. That facet is underneath there. That's the dens. Here's that dens. Here's that dens. And here you can see how the two come together. So the axis is the dens, and you can see now the axis, how it looks compared to the atlas. When the two articulate with each other, this allows us to move our head in this no fashion. Next, then we have our thoracic vertebra. Our thoracic vertebra. Our thoracic vertebra also have a body to them. And their bodies now are going to be much bigger compared to the cervical vertebra. And these bodies exhibit, you can see these bodies, they exhibit costal facets for ribs, superior and inferior costal facets. When the rib comes in, here we'll see it'll come into contact with the bone here, right, same place. And it curves around, hitting here, and makes its way to the front. So comes here, curves around, hitting here, and then makes its way to the front of the body. The spinous processes. The spinous processes, you can see, are sharp, pointed, and angled downward. The vertebral foramen is much more circular in shape. And the transverse processes, here they exhibit transverse costal facets for the ribs when they come around. Next, then we have our lumbar vertebra. Our thoracic vertebrae get described here, you can see looking like giraffes. Okay. Next in our lumbar vertebra. Now we talk about our lumbar vertebra. Their bodies are much thicker, much bigger in size compared to all three. They have the thickest bodies. They have pedicles and laminae. Their pedicles and laminae are very short and sharp. Short and sharp. Their spinous processes, short, flat, hatchet-shaped. Spinous processes, okay, short, flat, hatchet-shaped. The vertebral foramen, you can see going back to being triangular-shaped. And then here we've got articular processes. Superior up in here, articular processes, and then the articular facets, and then the inferior articular process, and then here's the facet. So you have to be able to know the difference between the process and the facet. If I point there, you can't just say, oh, it looked like both. You're going to miss the answer then. So you have to look up the definition. You have to understand it. Next then is a sacrum. So here these are described as looking like moose. Next, let's move down to then the sacrum. Now when we talk about the sacrum, you can see here 5 vertebrae that have been fused together as we've described. The sacrum is going to have the superior articular processes. So here you can see the superior articular processes, okay, on both sides. And they're going to articulate with the inferior aspect of L5. Next then we have our auricular surface. The auricular surface is found on the posterior lateral aspect of the sacrum. And this surface is going to articulate with the same named surface. It articulates with the same named surface of the coxal bones, the hip bones. Next in here we can appreciate the sacral promontory. The sacral promontory is found at the anterior superior margin of the first sacral vertebra. Found at the anterior superior margin of the first sacral vertebra. And here we've got transverse ridges. These transverse ridges are the sites. They're marking the sites of vertebral fusion. They mark the sites of vertebral fusion. And then we have the anterior sacral foramina. You can see from the front. We flip it around. We'll call them posterior sacral foramina. So kind of something easy there. Then we have the alae. The alae are the wing-like parts. So you can see here they're wing-like parts of the sacrum here. Those are the alae. Next then is the median sacral crest. The median sacral crest found right at the midline of the posterior aspect. And then lateral to that we have the lateral sacral crest. The lateral sacral crest. And then right here at the superior aspect of the sacrum we have the sacral canal. And then at the inferior aspect of that sacral canal is the sacral hiatus. Or you could say at the superior aspect of the median sacral crest and the inferior aspect of the median sacral crest. And last we have the coccyx. We said here you have basically 4 bones that have been fused together. Let's talk then thoracic cage. Thoracic cage. Now when we talk thoracic cage, the thoracic cage is going to be constructed, we can see here, of a few different bones. First here we'll talk about the sternum. The sternum. The sternum is known as the breastbone in layman's terms. The sternum is made up of, we can see here, first the manubrium. Second, you've got the body. And third, we have the xiphoid process. So the manubrium, in relation to the manubrium, we have clavicular notches. These are going to be notches found in reference to the clavicles. And then we'll have the jugular notch, or we can also call that the the suprasternal notch. Jugular or suprasternal notch. Then we have the sternal angle. The sternal angle, also known as the angle of Louis. Next in here we have the body. In relation to the body, then we're going to be able to appreciate costal notches. Notches in relation to the ribs. And then last we have here the xiphoid process. Now the xiphoid process and the body come together at the xiphi-sternal joint. Very important structure. You have to be really careful in the Heimlich maneuver not to fracture this. Then we have our ribs. Our ribs. We talk about the ribs. Now, when we go through, we see ribs are going to get classified as being our true ribs, rib pairs 1 through 7, also known as our vertebral sternal ribs, because they make their way from the vertebra all the way to the sternum. Then we have our vertebral chondral ribs, or our false ribs. And then we can further subclassify our last two pairs as floating ribs or just vertebral ribs. Now, when we talk about the structure of a rib, you can see the structure of a rib now here very nicely. Here you can see how the rib comes into contact with the thoracic vertebra, making its way around, and then making its way up to the front to the sternum. So first here we have the shaft. Now here you can see the shaft, a cross-section of the shaft. It allows us to appreciate this costal groove. This is where the nerve, the artery, and the veins are going to pass. So when we're talking about inserting chest tubes into patients, we are taught not to put that chest tube anywhere near the superior border of this intercostal space, near the superior border of that rib. You want to come down to the inferior border of that space or to the superior border of the rib below to avoid any of those soft tissue structures up there. Next then we've got the head of the rib. You can appreciate the head here. And the head is found on this neck. And then here we can appreciate the tubercle. The tubercle is going to actually come into contact with that transverse costal facet. So here you can see rib 1, ribs 2 through 10, and then 11 and 12. Just about the same. And then here you can see again how the rib is going to come into contact with that thoracic vertebra. And here you can see how each rib articulates with 2 vertebrae, technically speaking, at the body. And the same thing we can see here. So herniated disc we talked about. Vertebral fractures and dislocations, very, very dangerous. They can damage the spinal cord. And also skull fractures. Very, very serious conditions. They can fracture the skull, leading to brain damage, nerve damage, and even meningeal blood vessels being damaged. And then Lefort fractures are basically fractures of the facial bones. Here we can see whiplash can lead to fracture and nerve damage.